Okay, so I have Mila Bush here. She's an 80-year-old female. She is a full code and does have an allergy to the indomethacin, which does give her a reaction of hives and difficult breathing. Let's see here. She did have some vitals done. Her heart rate is at 99. Her blood pressure is at 118/66. She does have a temperature of 102. Her O2 saturation is at 92%, and she is reporting a pain level of 5. She did get some lab work done. It looks like she has an elevated white blood count, as well as a positive syphilis test. So the provider has ordered penicillin G procaine, 600,000 units daily intramuscular. So I'm gonna go ahead and get that out. Okay, so for my first check, I have Mila Bush. Provider has ordered the penicillin G procaine, 600,000 units per 1 ml. It is intact. It is not expired. This is going to go daily intramuscular. So the provider wants 600,000 units. We have 6,000 units. Times that by 1 ml, which is going to give us a 1 ml dosage for her. So I'm going to go ahead and get my supplies out. Okay, and it does look like my syringes and my needle are not expired and they are intact. Lock this and go to the patient's room.
Come in.
Hi, my name is Savannah. I'm going to be your student nurse today. Is that okay?
Yeah, that's fine.
Okay, I'm going to give you some privacy here. I am here to give you your penicillin G procaine medication. Can I just double check your name and date of birth?
Mila Bush, 3/28/1945.
Perfect. I'm just going to go ahead and just get that armband scanned really quick. Okay, so with this medication that the provider ordered, it is for your syphilis infection. Do you have any allergies?
Yeah, I'm allergic to indomethacin.
Okay, do you have any other allergies to any latex, adhesive, betadine, any other medications, food, or anything in the environment?
No, not that I know of.
Okay, and then do you have any hypersensitivities to penicillin?
No.
Okay. So with this injection, there are a few side effects that go with it. So please let us know if you experience any confusion, weakness, any dizziness, any headaches, and it can increase your heart rate too. So once we're done and I'm done with the injection, just let us know immediately if you start to feel any of those, okay?
Okay.
All right, so I'm just gonna move your table kind of just out of the way really quick, and I'm just gonna get your bed hired here. So with this injection, it is preferred to go into a deep muscle. Is it okay if we go ahead and do that in your thigh today?
Yeah, that's fine.
Okay, have you had any injections in your thigh?
Not recently.
Not recently? Okay. So there are other IM injection sites that we could use. So there is a deltoid. The deltoid muscle, you'll find that acromion process. You'll go 3 fingers down and you'll follow your axillary line and you'll go kind of right into that fat of the muscle there. The spot that we're going to be using today will be that laterolalis. You'll put your hand on the greater trochanter pointing down, and you'll do your other one on your patella pointing up, and you'll go kind of in that middle of that thigh area. Another spot would be that ventrogluteal area. You'll put your heel of your hand on that greater trochanter again, with your thumb going towards your abdomen, and you'll use your pinky and kind of go to that anterior superior iliac spine. And with your fingers spread open, in between your pinky and your ring finger, there'll be a V, and that's where you want to do that shot. But with today, that we'll go ahead and just do that thigh muscle, okay?
Okay.
Okay, so I'm gonna go ahead and do my second check here. Okay, so I have Mila Bush here. The provider has ordered the penicillin G procaine, 600,000 unit daily intramuscular, which we're going to go in the lateralalis. My bottle is not expired and it is intact. So I'm going to go ahead and get my medication all drawn up here. Make sure that I have 1 ml.
Yep.
Alrighty. I'll go ahead and get the needle switched over here. Okay, Mila. So with this going into your thigh muscle, are you okay if I lift your blankets up to kind of expose the area to take a look at it?
Yeah, sure.
Okay. Okay, so I don't see any swelling, any redness. There, I don't see any bruises or cuts. So I'm gonna go ahead and do my third medication check, and then we'll go ahead and get that medication injected into you, okay?
Okay.
Okay. So I have Mila Bush here. The provider has ordered the penicillin G procaine, which I have right here. It is intact, not expired. This medication is daily intramuscular, which we're gonna go ahead and give in that lateralalis. With the provider wanting the 600,000 units, we are gonna be doing 1 ml of this medication. All right, Mila, so I'm gonna go ahead and get that area all cleaned, okay?
Okay.
I'm gonna go inwards and then go out. And we're gonna let that dry. Okay, it is dry, so I'm gonna hold the skin nice and taut. I'm gonna go in at a 90-degree angle. I'm going to be injecting slowly. And I'm going to hold for 10 seconds. Okay, it does not look like you're bleeding at all. So you're okay with not having a Band-Aid. All right, so I'm gonna get you kind of all covered back up here, okay?
Okay.
All right. we gave Miss Mila 600,000 units. And that was in the right, that is lateralis. And we're going to update her chart. Okay, Miss Mila. I'm gonna get your bed lowered and then get your table back over to you. And please let us know by hitting that call light if you experience any the adverse side effects of like that confusion, weakness, any dizziness, or if you feel like you have an increased heart rate. So you got your call light in your hand here. So just hit that if you need us, and then I will come back in about 30 to 60 minutes to kind of reassess you, okay?
Okay, thank you.
Alrighty, thank you.
Mm-hmm.